Addison Correll vividly remembers the time as a child when she first realized she was different.
And I was like, oh, these kids are running around like it's nothing, and here I am struggling to keep up.
Her diagnosis, though, had come years earlier as a newborn baby. Mitral valve prolapse, when an abnormal valve causes blood to flow backward through the mitral valve with every heartbeat. Over the years, it can weaken the heart muscle, developing into congestive heart failure. For years, Addison was able to manage it with medications. But in her late teens, things got unbearable.
I can't even go upstairs. I can't walk. I literally felt like I couldn't do anything. It just felt like my heart was beating outside of my chest. Like you could see like my shirt, it was like moving.
At age 20, she had open heart surgery to repair her mitral valve. 6 years later, she has regular echocardiograms and checkups, and now Addison has something else she never dreamed she'd get: an answer.
I was like, oh my goodness, there's a name to what has been happening.
Shortly after transitioning into the Adult Congenital Heart Disease Clinic here at the University of Kansas Health System, her cardiologist suggested she get cardiac genetic testing.
So the testing that I offered Addison, called exome sequencing, looked at thousands of her genes related to her symptoms.
And genetic counselor Farah Amori says in one of those thousands of genes, they discovered a single misspelling. They don't call them mutations anymore.
Think of this gene as a very long sentence with a lot of letters inside. What they do is they check every letter to see if there are any changes in the spelling of this gene, and that causes the gene not to work the way that it should.
Further testing revealed Addison inherited that misspelling from someone in her family.
It's more solving this diagnostic odyssey that she has lived with for over 26 years.
For Addison, her answers came all at once. Her health journey also inspired her to change jobs. She's now an administrative assistant here at the health system, working in cardiac rehab, an area she knows well.
I love it. I mean, I see patients who've gone through something that I also went through. If I see somebody, having a hard time, I'm like, hey, I've been there. Here I am to show you that I went through it. You can also do it as well. It's hard, but it's worth it in the end.